Hello, I'm Dr. Cynthia Shughrue, and I have a general family practice and wellness clinic in Dallas, Texas, called Family Care Medical Services of North Texas. I have a general family practice as well as a integrative practice. I treat age 5 through 65, 70, 80, trying to help them maintain their wellness. The goal is to be extremely proactive and find the problem before it finds the patient. We do salivary testing, which would measure a patient's ability to cope with their stress. And from that, we can determine ways to mitigate their stress and monitor it and seeing if we're being successful. The other things we look at are their hormone balances and thyroid. We also do advanced lipid testing, which is different than just a standard lipid panel. So it gives us more information about inflammatory markers and risk for cardiovascular disease, which is also associated with brain health and Alzheimer's risks. So by looking at those markers, I can identify, again, other targets that are missed in a standard practice. Well, we see a fair amount of patients who struggle with weight. Some are morbidly obese, some just overweight, and the problems with that are mostly insulin resistance. And that insulin resistance drives a lot of other problems within their body that they're not even aware of. And it's not really what they see in the mirror, it's what they can't see that's important. Many patients have dieted and they've ended up yo-yo dieting and exercising and just not having the successes that they need. But it's because there's genetics involved and other factors that we have to dig down into to try to find so that we can personalize that treatment for them and really get them to have a success with their weight loss program. It's not just about eating less, it's about looking at their hormone balance, at their thyroid, at their genetics that help drive their metabolism and trying to understand how to correct that so that they can lose weight with the modalities in their lifestyle and their exercise programs and be successful and keep it off. I spend a lot of time with the patient really trying to get them to understand how food impacts their body and why I'm asking them to make the changes that they do. They need to have good, organic, clean food to have a very healthy, clean body. The majority of immune function does come from our intestine. And it's very important to have a good environment. So detoxification and making sure that the milieu that the stomach and the intestines are working in is important so that the rest of the body functions well. And we do test to see how someone's immune function is, how their gut, if you will, is working, and try to optimize that for them. And that's through food and probiotics and other modalities. And we follow that and try to educate the patient that antibiotics and other things, medications, will have an impact on how that system functions. Many times I'll see a patient coming in on many medications for a multitude of problems. One medication precipitated the use of another medicine and another one and another one. And many times if we can look for that root cause and work with that, I can eliminate many of the medications, not all, but the goal would be to try to get them on as minimal medication as they can using diet, exercise, herbals, and hormone replacement to get them to a state of wellness where we really don't need all those medications that they're on. Balancing hormones is very important for a person's overall health, and as a person ages, those hormones do decline, and that decline makes them feel bad. It also is associated with osteoporosis and other changes within their body that can be slowed down with the use of bioidentical hormones. Bioidentical is safe because it's exactly what your body made. It's not a synthetic. The goal of bioidentical hormone replacement is to restore the hormone levels to their natural states as they were in their optimal age in their 20s and 30s. In functional medicine, our goal is really to ask why. Why is someone not feeling well? Why do they have heartburn? Why do they feel tired? And to keep digging and digging and digging, not just giving a pill to say, oh, here's your pill, gone your way, you'll feel better tomorrow morning. When we dig down and try to figure out why, then a patient ultimately has a better result in the long term. So if you'd like more information about me or my practice, you can go to our website at drcshughrue.com, and all of our contact information is there.